Welcome to the Conduit DataVision Gateway webinar, Unleashing the Power of Your Enterprise Dashboard to Improve Your Patient Outcomes and Performance. Now let me introduce our presenter for today's session, our very own Richard Graveline, who comes to us with an extensive healthcare background and is here to present you with our informative session on DataVision Gateway. Welcome, Richard.
Thank you, Nancy. And hello, everyone, and thank you for sharing your time with us today. I'm excited to show you one of our newest product offerings from the Midas family of solutions. More specifically, I want to showcase an enhancement to our DataVision line of performance metrics we call DataVision Gateway. And I want to make certain we touch on a few topics during the time we have today. I want to talk briefly on the importance of having the right data at the right time and getting it into the right hands so that you can recognize those improvement opportunities and take appropriate action quickly and reliably. Next, we'll take a look at the numerous challenges we face to achieving this goal. Then I want to touch upon building on our existing strategic partnership by leveraging what you already have, which takes us into how best to manage the time and effort it takes to deal with all those complex CMS algorithms. And finally, I'll leave you with some key takeaway points. And as Nancy mentioned, if you have any questions or comments during the presentation, please submit them in the chat window and we'll be happy to address those. Now, everyone on this call today knows the importance of having sound data when making decisions. But the key here is knowing as soon as possible where your potential areas of concern are while you still have the time to correct them. And this year alone, CMS stands to penalize over 2,500 hospitals for having excessive 30-day readmits for certain Medicare populations. And these patient conditions are quite common among that population group: heart failure, heart attack, pneumonia, knee and hip replacement, among others. All quite common and all with a propensity for readmission. There may even be some attendees here today who are facing some possible CMS penalties. And those penalties can be as high as a 3% reduction in Medicare payments. So while we're on this topic, let's talk about some of the other challenges. Metrics in healthcare are by nature prone to be complex in definition, measure development, and their recurring maintenance. Now, you can attempt to reproduce those metrics, but that would require many resource hours on your end to understand those changes and develop your internal metrics to match. Not to mention that regulatory metrics are evaluated and may be adjusted annually, requiring that cycle of analysis and development to repeat year after year for the duration of those metrics. And failure to replicate those definitions accurately could produce a false image of your organization's performance, potentially leading you down the wrong path to improvement. Regulatory results are also published 1 to 2 years after that evaluation period, making it difficult to gauge current performance or even to forecast future performance, knowing those metrics may change down the road. Some organizations may not even know their final CMS scores until they're made publicly available. And while business intelligence tools will certainly move all of us forward in helping shape our decisions, you really can't get a full picture of the problem unless you can drill all the way down to the patient level detail. Without that level of detail, it becomes easy to make the wrong decision. I've worked with enough hospitals and poured through enough data to know that just a few patient encounters coded incorrectly can cause a world of confusion and bad decisions. Now let's expand on some of those challenges before we turn the talk over to how DataVision Gateway can help you overcome them. There's 4 main pain points here: making optimal use of the DataVision product, being able to make effective use of the limited time you have to address deficiencies, being able to easily integrate the wealth of information in DataVision into your business intelligence tool, and finally, reducing your internal development time required to maintain and manage those changing metrics. Now, DataVision by itself is a powerful tool already in your hands. There are currently over 14,000 rate-based measures at your disposal, collecting data constantly and available when you need it. and all capable of showing you that patient-level detail with any one of them. And while DataVision will certainly help you forecast, we know that getting that information into your BI tool quickly will only help you make better decisions and ensure that you have the tools you need to stay ahead of the competition. However, BI tools can be complex to understand and manage, especially when you're trying to integrate other important data sources stored in your organization's databases. As with any technology, there is immense growth potential and product development with BI tools, but that can also lead to a constant cycle of re-education and training. Does your full-time BI professional really have the time to deal with complex algorithm mapping and validation? Okay, enough talk of the pain. Let's talk about some pain relief. DataVision Gateway provides a bridge between your existing DataVision measures and your business intelligence software. What this means to you is that you get the ability for your BI tool to have direct access to those 14,000 measures. You choose the measures you want to focus on. That means one single data source for all those measures into your BI tool. But DataVision Gateway provides you with another unique opportunity to leverage and expand upon the strategic partnership that you already have with us. Let our team of professionals take the worry and angst out of trying to navigate the ever-changing world of regulatory measures. Our dedicated teams proactively review changing requirements and plan our metric changes accordingly. So whenever CMS or other agencies change their metrics, your DataVision metrics are updated. This allows for a seamless transition from one change to the next, and all without wasting resources and frustration on your end. So let's get into the details of how DataVision Gateway can seamlessly blend your existing DataVision measures into your BI tools. Using an ODBC compliant connection, DataVision Gateway allows your BI tool to easily subscribe to any of those 14,000 measures. And the setup involves adding a process-focused study to your existing system to allow for that easy subscription to those measures. Doing so allows your BI tool access to all of that patient-level detail in Midas. But it also has the benefit of reducing the need to merge data from multiple data sources into your BI tool in order for you to get the complete picture. If that patient-level detail exists in Midas, it will be available in your BI tool from that same single source. And DataVision Gateway is designed to work seamlessly with some of the most popular BI tools on the market, including Tableau, Power BI, MicroStrategy, and SAP Crystal Reports. Plus, Gateway integrates with your existing enterprise data warehouse, including many vendor-specific versions. And let's jump back to leveraging the resources you already have. CMS metrics are complex, and failure to comply with them comes with penalties and fines, which is why I chose them as the earlier example. But DataVision offers a wealth of other metrics at your disposal, including our existing metrics for clinical outcomes, AHRQ patient safety and quality metrics, the Midas risk-adjusted metrics, and other national agencies like Joint Commission, Leapfrog, and HCAPS. Now, with so many measures available, each member of your senior leadership team can determine which metrics best present the data they need to make their informed decisions. Now let's compare your existing DataVision product to what can happen when you combine DataVision with your business intelligence software using Gateway. The DataVision product, available currently in your Midas solution, has always had the ability to provide you with standard graphs. In years past, these relatively simple graphs were good representations of your organization's performance. They were easy to view and could be shared and understood by a large audience. But bar charts and run charts can't tell the whole story. Healthcare is ever-changing, and if this last year has taught us anything, it's that our best chance to remain viable is to be able to sort through the data, remove all the noise and clutter, and use that data to better plan for your organization's future. And that is one of the biggest benefits of merging DataVision to your BI tool. It brings you just a few steps closer to being able to predict what may be coming down the road by taking the data you already have in Midas and bringing it into the modern business age. Gateway uses the power of your BI tool to disseminate, restructure, and present your data in ways that make it easier to notice trends and patterns. Things that might indicate changes in your practice, changes in the population you serve, but more importantly, how changes in regulatory requirements will impact you down the road. SPC charts, cluster diagrams, ribbon charts, all of these come together to showcase your data in ways that help you make sound leadership decisions, decisions that are based on solid evidence. So let's wrap all this up in a bow. Making the move to DataVision Gateway will help you get closer to identifying your opportunities sooner. Doing so helps you stay ahead of the competition and take out the headache, frustration, and wasted resources trying to stay abreast of all of those regulatory changes. You already have a dedicated team of professionals at Midas who will take care of all of that for you. And that's something I really want to reinforce. While you may have the internal resources to manage these changes, even one mistake in your metric design can lead to bad decisions down the road. With DataVision Gateway, you can be confident that any changes we make to these metrics on your behalf have been thoroughly researched, tested, retested, and validated before any adjustments are made to your system. And leverage what you already have with your existing DataVision. By using those predefined and maintained measures in DataVision, you can drastically reduce the time it takes for your internal metric builds and free up those resources for analyzing the data. As I mentioned earlier, DataVision Gateway works with most established business intelligence tools, a few of which I mentioned previously. But if you currently have a BI tool and want to know about its compatibility, just ask in the chat window and we'll be happy to verify that for you. And another benefit of leveraging that partnership you have with us. This relationship doesn't end when you implement Gateway. Like all our other Midas products, you'll have access to our DataVision support team and our regulatory compliance experts. But more importantly, we want to know how this enhancement is working for you. So we will remain in close contact for several months after the implementation to ensure that you're getting the most out of this new product. We currently have clients across the country using DataVision Gateway. Some of these clients are taking advantage of the leverage with DataVision metrics to build much more comprehensive scorecards for their organizations, or building specific detailed dashboards for their senior leadership team or board of directors. Even customizing individual scorecards for special projects and improvement efforts, or simply to enhance their existing enterprise data warehouse. As I mentioned earlier, every client you see represented here, we are still in close contact with to ensure that our new product is meeting the individual needs of each of those individual clients. So whatever reason you have to consider upgrading your existing database solution, you can feel confident in knowing that rigorous testing was done to guarantee that the Gateway solution is effective, safe, easy to install, and fully supported by our team of experts. Now let's see if I can sum all this up in one last slide for you. You already have Midas. You already have at least one BI tool. There's simply no need for you to reinvent the wheel. Make the best use of what you already have and bring those two together. Like I mentioned earlier, measure development is complex and very resource intensive. You shouldn't have to spend unnecessary time building and maintaining measures that change frequently. Midas is committed to supporting you by maintaining those clinical, regulatory, and accreditation measures for you, and thoroughly testing those changes before ever releasing them. And that goes directly to your return on investment. Spend less time building and maintaining, and more time analyzing and improving. And of course, being able to add hundreds of metrics at one time to your BI tool with just a few button clicks is an immense time saver. Plus, very little training is needed on your end to implement DataVision Gateway. Again, less time building and more time improving. To learn more about how DataVision Gateway can assist you in achieving those organizational goals, please visit the Conduent website at www.conduent.com or contact us using the email address you see, and they'll be happy to put you in touch with the DataVision Gateway support team. You can also reach out to your client service manager. And that concludes my presentation for today. I want to thank you again for sharing part of your day with us, and we look forward to collaborating with you on this exciting new offering from the Midas family of solutions.